Hi everyone, Dr. Amanda here with another video for you all this week. So as you can see, I'm in the office today, and I just wanted to take some time to talk about something that's very near and dear to my heart regarding medicine. So today I'm going to talk about good medicine because I feel like there are a lot of things that happen within the medical community that are just really unacceptable. And I want to just increase awareness about some things that we've allowed and permitted within the medical community. The first thing I want you to think about is, when is it acceptable in any other arena for watching and waiting? Oh, let's just watch and wait to be acceptable. Suppose a second grade teacher comes to you, your child, and says, "Oh, little Johnny can't read, but let's just watch and wait and see what happens." Is that acceptable? Really? Yeah. But in medicine it is, apparently. There may be other alternative things that can be done instead of just sitting there and waiting for your body to continue spiraling down this hill of dis-ease and illness. So yeah, that's unacceptable. Okay, the next thing I want you to consider is, let's say for example your brakes are squeaking and you take it to your mechanic and he says, "Oh yeah, we're gonna fix up your brakes for you, Miss Johnson, but you may eventually have problems with your catalytic converter based on how we're gonna repair your brakes, and then later, maybe in like 5 years, you're probably going to have engine failure too. But that's okay because for now, your brakes don't squeak." Sound familiar? It should, because it happens every day in medicine. Yet, this is acceptable in the United States now for whatever reason. So, I'm here to challenge my viewers to just kind of think outside of the box and to be on the lookout for docs who are practicing good medicine. First and foremost, you want to find someone who cares genuinely about you as a person. You're not a number. You're not just this package of organs that can be cut up and separated and, manipulated to do and function the way that we want it to be. You're a person. And if your physician doesn't recognize that or see you as a person, then maybe you should think twice about continuing to see this person for health care. Okay? Because you are a person, and relationships are very important, especially in medical care. Okay? So be sure that that person who you call your physician actually cares about you, knows something about you. Like, what's your life like? What are your relationships like? Are you happy? Do they care that you're happy, or are they just going to try to whip out their prescription pad and put you on some kind of antidepressant? Okay, make sure that the person who you call your doctor cares about you and knows who you are. Secondly, prevention is very important. So if the physician or doctor that you're seeing doesn't really understand that prevention is much more than just vaccines, then perhaps you should consider again seeking another professional's opinion. Prevention can be related back to examples similar to the watch and wait scenario. Many times patients have things that may not be detectable or may not be giving blood or serum levels that are indicative of certain pathologies. So in instances like those, many times physicians say, "Well, let's just see what happens with the numbers." However, there are a number of things that can be done instead of just sitting there waiting on numbers to dictate or say, "Hey, you officially are a diabetic now." No, we don't have to wait for your hemoglobin A1C to be high enough for you to be diagnosed with diabetes before we can start doing something. We can do something now and prevent that from happening. So again, if your physician isn't aware of those things, then maybe you should consider seeing a physician who can prevent you or help prevent you from getting things like diabetes or other things where you just kind of like watch the numbers and then it's diagnosed. Finally, you want to look for someone who understands that the least invasive approach is the best approach. Sometimes there are many recommendations for surgeries that aren't necessarily required. And it's important that, again, when you have a relationship with your physician, they know when it's necessary for you to have surgery. And if you've established a good rapport with your physician, they won't recommend that you have surgery unnecessarily. So again, the least invasive approach is the way to go in medicine. Be mindful that there are lots of great doctors out there. And to my colleagues, I commend you all for all of the work and the effort that you're doing and putting in for the sake of the health of your patients. Let's encourage and motivate other colleagues to do the same and to not be so quick or so apt to whip out a prescription pad and or refer someone for surgery when those things aren't necessary. As patients within the naturopathic medical community, you can find doctors who understand these things and who can develop genuine relationships with you and give you a second opinion about what's really necessary or not. I encourage you to do your homework, research, and find out what's going to work best for you, because good medicine is necessary for you to thrive and achieve your purpose. Be on the lookout for good doctors and get on their schedules immediately, and then you'll see and know the difference. Remember, everyone, health is here. Take care. Bye-bye.